Hi, I'm Jennifer Castle. I'm a third-year resident from the University of Kentucky. I will be presenting our project titled Rapid PICU Access in Pediatric Trauma Patients. I have no financial disclosures. Our project sought to assess the impact of having the Pediatric Intensive Care Unit attend all of our highest pediatric trauma activations and how that might reduce the ED length of stay. Previous research in the adult trauma population has shown that institutional changes aimed at quicker patient transfer to intensive care units has been associated with decreased emergency department length of stay, hospital length of stay, complication rates, and mortality. Similar research in the pediatric population is lacking. Between 2014 and 2017, a new policy was implemented in our institution in which the PICU team leader and PICU attending were required to attend every one of our highest pediatric trauma activations, designated at our institution as a Trauma Alert Red. Prior to 2014, only the emergency department staff and pediatric surgery staff were required to attend the Red activations. We had a pre-implementation group between 2012 and 2014, which consisted of 52 Red activations, and a post-implementation group between 2017 and 2019, which consisted of 70 Red activations. The ED length of stay for all Red activations admitted to the PICU was compared between the groups. We excluded all patients who died in the emergency department and those who went emergently to the operating room from the emergency department. We found that the post-implementation group showed a statistically significant decrease of a little over an hour in their ED length of stay when compared to the pre-implementation group. And as seen on the graph here, where the individual patients are plotted versus their length of stay, the blue data points representing the post-implementation group show a more consistent grouping, thus demonstrating a more consistent timing of patient transport than the pre-implementation group. So, in conclusion, we found that having the PICU staff attend all Red activations facilitates a more rapid transport to the PICU with decreased ED boarding time. The benefits of how we approached this change is that we did not have any changes to our staffing model and thus did not have any increased costs associated with this mandatory attendance. Our next steps in this research is to further evaluate the effects this has on our patient outcomes. Preliminary data has shown similar total length of stay between the groups as well as similar mortality and complication rates. These are my references from our paper. Thank you for watching and listening. If you have any questions, I can be reached at jennifer.castle@uky.edu.